For those of you who don't know kind of what we do at Box, we try and make it really simple to store and share and manage and access information. Has anybody ever had to use SharePoint before? Okay, so we're sort of the exact opposite of that. So what we try to do, yes, oh wow, thank you. Great, claps for that. Okay, this is, I apologize for what you've been through if you had to clap about a SharePoint thing. So, but what we try and do is we try and make it easy to collaborate around information. And we started the company 8.5 years ago in college, and the idea was really simple. That, we thought that you could put together some computers in the the time it wasn't cloud but online, and let people store their files in that cloud environment, and then be able to access that data from anywhere. We got really lucky because all of a sudden mobile devices and the need to collaborate around information became really critical for every enterprise in the world, and we found ourselves with a much simpler approach to solving information sharing than a lot of the traditional incumbents. That was the sort of story for the first 5, 6, 7 years of Box, and what we decided was the next sort of era of our company had to move beyond just providing a horizontal platform and going after all industries sort of indiscriminately, but rather how do we actually go after and serve different industries in unique ways where we can have a much more kind of significant amount of value by working with new kinds of partners, with having new kinds of alliances, with being able to support the different kind of standards in that industry. And I guess when we looked at everything, we saw a few verticals that had the kind of highest propensity to the transformation in the kind of next few years, and the amount of need and demand there was for cloud services that we felt were going to be upcoming, but then also most importantly where we could really differentiate from our competitors. So from where we're being able to go much deeper from a compliance standpoint or regulatory standpoint, being able to work with the industry was going to produce sort of disproportionate outcomes. And then I think we just got pretty excited by different spaces in kind of different ways. And so that led us to having healthcare as one of the top verticals that we looked at, and then that ended up being the first one that we truly invested in from a launch standpoint and going to market. So we today work with, this is, sorry, the longest monologue ever. So we work with, we have about 600 or 700 healthcare institutions and some sort as enterprise customers. So we're really investing pretty deeply in the space. But yeah, pretty excited by the innovation going on here. And
you've also made some interesting hires, right? I mean, Missy Krasner from Google Health. Is she here?
Yeah, Missy somewhere. She's been advising us and leading our healthcare initiative. And hopefully this will end slightly differently than Google Health, but we're pretty excited by. She has an unbelievable amount of experience in the space, so we're very excited to have her on board helping us.
So what's been the biggest?
That's not offensive, right? Okay, just to Google. Okay, good. Okay.
What's been the biggest challenge that you faced navigating healthcare? I mean, because I remember when we talked earlier about HIPAA compliance. That's definitely not a word that you hear a lot when it comes to the hardcore tech.
Actually, most of our employees spelled it wrong the first couple hundred times.
Oh, really?
So they had 2 P's. So don't tweet that. Thanks. Okay.
So what was the challenge when you started down that road of healthcare?
Yeah. So I mean, the first thing is you have a lot. I mean, there's a number of issues, right? So from the inside out perspective, the challenge was, well, how successful are we going to be in this space? Are they really going to be adopting cloud solutions? Like you generally hear, and sorry, I don't know who I'm offending, but you generally lump sort of healthcare and federal government into like similar categories of like the slowness of IT and innovation. And right. So there's a lot of concern internally that we would go invest pretty significantly in a new set of compliance and regulatory efforts just to sort of have it shut down by the industry, and that it wasn't going to be very successful. The point that we had to counteract that was we were actually already seeing a lot of end user demand of the service and of the product in the industry, so that gave us enough of an indication that we thought there was going to be a space here that we could go serve. And then the second part was, as we looked out at the industry and we talked to customers, we talked to potential partners and people and institutions in the industry, there was a little bit of resistance to, well, are we able to, as an industry, move to the cloud yet? Is it secure enough? Is the cloud mature enough? Are the standards there? Can you have the right kind of integration across applications that we're using? And so, that we were able to overcome by realizing that was a very similar pattern of sort of pragmatism that we saw from a lot of our enterprise customers previously in other industries. So, I think if you just look at the Jeffrey Moore technology life cycle that occurs, or the technology adoption lifecycle. There's sort of a whole wave of how adoption works, and everybody in this crowd is obviously on the sort of deep innovator side. I mean, it's got Google Glass and everything in the corner. Like, so we're not the mainstream in this room, and so we wanted to make sure that this was going to be a trend that companies would actually be adopting the cloud in a healthcare environment, whether that was on the research side, on the hospital side, on the insurance side, and that was where we saw a little bit of resistance, but we overcame that with the right kind of compliance efforts, the right kind of partnerships, the right kind of leadership, and that's kind of where we are now.
So, I mean, it sounds like, your growth in hospitals and other healthcare providers using Box has been pretty dramatic over the past year. What has changed on the healthcare side when it comes to content storage and the cloud that has allowed for that?
Yeah, so I think, what's interesting is from what I've seen at least, and talking to different providers and customers of traditional enterprise software in healthcare, I think the healthcare space sort of followed a very similar evolution to what traditional enterprises followed from an enterprise software standpoint. So in traditional enterprise environments, the 70s and 80s and early 90s brought this sort of huge amount of adoption of ERP systems and sort of deep sort of run your business, run your supply chain, run your finance kinds of systems, and that was what enterprise software was. And that's what sort of defined the industry. And I think similarly, in healthcare, a lot of the software and a lot of the technology was sort of run your hospital, run your billing, run your administration, and that was what IT was. And what we saw was that helped you run your businesses internally, but it didn't really help all of the external and sort of collaborative ways that people were beginning to work. And it actually made sense, right? If you think about it, only in the past decade or sort of decade and a half have we become, as consumers, very well acquainted and literate with computing and technology. So technology started out just in the corners of an organization, and it made sense as just sort of back office types of applications and services. In the past sort of 5 years or so, we've seen a huge swing towards more of the innovation on the periphery of that. So when a doctor needs to be able to pull up a piece of medical information when they go home and they need to be able to look at a patient, or when researchers need to be able to collaborate back and forth on PHI, with information with PHI that is on a specific research project that they're doing, or when an insurance provider needs to be able to communicate back out to the patient as well. So in all of those cases, unstructured content and documents and files are sort of what are being shared, and what we found was we actually had a pretty strong solution to help people do that, because a lot of that information was going into email systems and deep sort of content management systems that weren't allowing people to get it out of those technologies. And so we started with a lot of end user adoption, and then we decided we'd layer on a sort of go-to-market effort that would allow us to go work with the various companies and partners in this industry. So today, the really exciting thing and the biggest catalyst for our growth, and I think probably for 50% of the innovators in here, are iPads and tablets, and the ability to now pull down information from any device at any time, and the cloud is fundamentally what is powering that. And so you have this massive step function in technology paradigm, both from a delivery standpoint and from a device standpoint, and they come together at the exact same time in terms of level of maturity and level of sort of relevance for industry. And I think that's what we really lucked out on, is that all of a sudden you'd have a hospital with dozens of doctors that were pulling up iPads and pulling down medical procedures or medical information from that device, and we happen to provide a back-end system that can help you store and manage and access that data on demand.
So, speaking of pulling up medical information on your iPad, you guys, Box made one of its first actual corporate investments in a company, Dr. Chrono, a healthcare company that basically does electronic health records on the iPad. Why that company, and what really kind of was the signaling for you to make that first investment? Yeah,
so everybody I assume knows kind of Dr. Chrono, but the idea was really simple. I mean, they were doing some really innovative stuff on mobile. They were aligned with the same trends that we were seeing as an industry, and what made it possible for us to go serve this space. And we wanted to not only be able to help power some of the back-end storage for some of the medical information, but also get closer to the market. So we made a small investment from a corporate standpoint into the company to to, as a way to get much more aligned with the company. And what we're doing actually as a platform, and that's actually where we're probably going to serve the market most effectively. So, if you think about what we do, we're sort of a horizontal layer that helps you store and share and kind of manage data. But we think that a lot of the innovation and the ways that we're going to serve the healthcare industry are on top of that layer. So it's not going to be you logging directly into Box and experiencing our application always in the healthcare community, but actually through third-party services, whether those collaboration services, whether those are medical record systems, whether those are imaging products. We want to be the back-end layer that helps you store the content, share the content, secure it. And the benefit is you get all of the HIPAA compliance, you get all of the other security innovation that we're doing extended into your application. And so that's what we're doing with Dr. Chrono, but we have a dozen or so other partners that we're working on that with, and we're trying to do that across the entire space.
Yeah, so what are some of your favorite use cases of Box in the healthcare world? I mean, because, it sounds like x-rays. I mean, it's really across the gamut from, healthcare records to much, much more.
Yeah, so today we're because of the very nature of how we get brought into an organization, we're tending to start with, again, a lot of the use cases on the periphery. So you have to be HIPAA compliant for many of those even, but it's the ones that that the researchers are bringing in. It's the ones that the people that have to have a library of all the medical procedures that they extend onto mobile devices. A lot of those use cases are where we're starting. We're not going to be an EHR provider ourselves, so it's much more around all of the collaboration and the care coordination that happens around the healthcare process that we're going to be able to serve pretty effectively. And in a lot of cases, what you have, if you go look at, I don't know if you guys talked much about like shadow IT today, but that big kind of trend in IT today is that every individual is bringing their own technology into the workplace, and a lot of those technologies are having challenges because data can then leak outside the firewall, can leak outside the network into non-compliant systems, and we think that we can provide a solution that gives hospitals or research institutions or universities the ability to have a sanctioned technology where they can store information that's going to allow them to be compliant, but it's going to give the end users the same kind of ease of use and elegance that you get with a pure kind of consumer solution that's being brought into the healthcare industry today.
Does your doctor use Box?
So, very good question.
Are you still selling them on it?
So I guess my mom's not in this room probably. So I haven't seen my doctor in about 18 months. So it was actually, we were not in the healthcare industry then, so I wasn't selling her on it. But this is a very good point. And
I'm glad that I brought it up.
Yeah, thank you. So we're going to work on that.
Do that.
But no, we're certainly getting with a lot of hospitals and a lot of the institutions in and around our area, which is Los Altos, Palo Alto, but obviously kind of global as well. We work with MD Anderson, working with Wake Forest. We work a little bit with Stanford and do some stuff there. So we're pretty excited by a lot of the innovation and adoption that's occurring right now.
So I think it's pretty fascinating that on a personal level,
my dentist uses our product.
Well, that's
there
good.
You go.
That's
okay.
great.
I'm related to him though, so.
So he has to.
Yeah, okay. Technically, yes.
So I think it's pretty interesting that on a personal level, you're making individual investments as Aaron Levie in healthcare startups.
Yep.
So clearly you're pretty passionate about this space and the potential for health tech. What are some of those startups and why are you making investments in that space?
Yeah, so I mean, so a couple of the investments of Comprehend Systems, Flatiron, Zenefits. So companies in and around the innovation in the space. A couple of companies doing some big data analysis and technology on the kind of research side. So when you think about cancer and drugs, some pretty cool technologies there. And I mean, very passionate about the amount of transformation that's happening, and I think also just economically kind of makes sense. But when you think about a space which has hundreds of billions of dollars of IT spend and sort of spend around the periphery of IT, and the vast majority of that spend is going into legacy technologies, legacy systems, that's a pretty classic case of disruption potential, and not just in the sense that we get the sense that sort of in the valley that you just disrupt things because that's the way that you can kind of create new opportunities and innovation. But in the case of healthcare, the change in kind of outcomes, the change in delivery, the availability of healthcare, that's what disruption truly is going to be able to power in this industry. So it's incredibly exciting when you see all of the kind of companies that are emerging that are going to radically change how we experience healthcare and how we can work with doctors and how we can communicate communicate and collaborate with the care providers, and the ways of making that available to far larger populations. There's no way that we have a sustainable model of healthcare in the country, and the only way that we're going to change that is, yes, on the reform side, but probably actually we're going to be more successful driving change in the underlying delivery of healthcare and how people actually experience it. So, why do I have to go into a doctor when I can have all of my, key vitals and key information that I have on demand that can, be delivered right to my doctor, and then they can tell me when it makes sense to come in. There's a lot of very antiquated processes and technology and procedures in the industry that technology, should and can and is starting to change.
So last question before I open it up to the audience.
Okay.
What healthcare apps? I know you're not seeing a doctor regularly, but what healthcare apps do you personally use, or do you use any wearables?
I like to say I have an opportunity to see my doctor more. So I don't have a wearable, unfortunately, mostly because I also don't want to know how unhealthy I am at any given time.
Knowledge is power.
Knowledge is power, to be depressed. So, I personally am probably not like the, poster child of great health and caring for your health, but the company is trying to be. I gave my girlfriend an up. She subsequently broke it, so or lost a little like thing, so now it hurts her wrist. I think there's a lot of innovation happening on that side of things. I think any way that we can, again, any way that we can have way more analytics and way more sort of programmatic and algorithmic ways of knowing about our health and what we're doing is going to change outcomes in the industry. Everybody kind of is starting to kind of be on board with that. So it's just incredibly exciting to see what you can do now.
Well, Hallie's giving me the eye. So, I think we're...
So you just got... Okay, fine. Don't you... I thought you... Don't you, get up and start yelling?
No, I'm going to
Okay, got it. Okay, cool.
Thanks, Aaron.
Yeah, thanks a lot, guys. See you later. Thank you.